welcome to the CDO Magazine interview series. I'm Jake Dreier with HiLabs, and we are partnering with CDO Magazine, MIT CDO IQ, and the International Society of Chief Data Officers in a series of interviews. And today I have the pleasure with speaking with Krister Johnson, who is the Chief Analytics Officer at Healthfirst. Krister, welcome.
Welcome, Jake. Nice to be here.
What are the use cases that you're seeing develop that you're most excited for? Not necessarily the ones that are ready for your team and the organization to start implementing and exploring, but yeah, what are the use cases that you're seeing on the horizon that interest you, that excite you, that you think will be particularly transformative?
Yeah, so I've mentioned natural language processing, text analytics. So I think that's really big. Using those technologies to get more information from all the clinicals in a scaled way. Video analytics in the radiology space. That's all really. I'm very excited about that. I'm really looking forward to that. There's several other areas. The one that excites me the most right now is this notion of using graph database technology to build a really robust time sequence customer journey database. And what I mean by that is where at one place in a graph database, and by the way, we're exploring, and I think graph database is the right thing for this because you get access to a little bit more analytical techniques that can be run in a graph database environment than if you try to do it in a relational environment. That's why I think graph database is important here. But if you can get all of the data, the web interactions, the mobile interactions, the phone interactions, the claim interactions, the enrollment and billing, any other things that you can think about for your members, and you put that all in one place, and it's easy for everybody to say, I want to know all the things we know about this member for the last 6 months, and it's all in one place, and you've got a timestamp on every single event, and you have all the attributes of those events. That provides people with this robust think of it almost as a dictionary of everything that happened that's relevant to that member that you can then use to identify patterns and proactively identify patterns that represent opportunities to intervene or engage with members in ways that are going to improve their health. So the time sequence customer journey in a graph database is it's probably the thing I'm most personally excited about, also because we're right in the middle of working on this right now with a partner of ours. So that's one. There's another area that I don't really know exactly how we're going to approach this, but I've mentioned several times health equity. Health equity is incredibly important to us. We think that especially for the Medicaid and Medicare population, one of the big things that we see on the CAP surveys and things like that is that our members have trouble getting access to care. And so this notion of how do we help people get access to care is really important to us. And when you just look at claims behavior and say, hey, these people haven't been accessing care, well, in some cases, people may not have tried to access care. And so what we're trying to do is figure out ways, this goes back to the data collection conversation we're having earlier. How do we actually get more information about when somebody was trying to get an appointment and couldn't, and how hard did they work, and what are the aspects of that? And so we're really focused on trying to, one, collect more data around when people are trying to gain access to care. One way you do that is to provide some digital channels in which to schedule appointments and things like that, maybe share data with various provider systems and things like that. And so, and then once we do that, then I think there's a whole lot of machine learning that we could potentially do to help with that. And I think that ties back to giving more transparency and more, I'll just say more transparency for us, for the providers that are in our network, because as I said earlier, over 70% of our business is all value-based care. And so we kind of owe it to these providers to start to give them more information and insights about how are their doctors providing access to care, and how can we improve that? So those are just a couple of areas that I'm personally really excited about.
So as you're thinking about these, I'd say these innovations and transformations, that has a very real impact on teams and the people and the organization, how they've built out their data analytics teams. But we know that this doesn't happen in isolation, right? It actually is pervasive across an entire organization. And I would be really curious to hear how you have seen the rise of these advanced analytics tools transform the makeups of teams, not just for yours, but across an entire organization, across all of Healthfirst together.
Yeah. So if I think back in time, right, I used to run projects where we'd build a model, and it's really important to have interaction with your business stakeholders up front to understand the problem, to understand the types of things that might be relevant. And so, but to some extent, there's always been this notion that the model building process, the making of the sausage, is a little bit of a black box. And so for us, when we think of teams across our organization, we've been taking very explicit steps to make sure that isn't that black. We don't build models that are black box. We always explain it, but there's still just, I guess, intellectually, it's other people that are not involved with building the models feel like they don't quite have full transparency or visibility into what's happening. So we're really focused on ways to structured collaboration across the whole process of building and then testing and then validating and then operationalizing these analytical models. And so that's been really important, just to figure out more structured ways to engage and make sure that all the business stakeholders have full visibility and transparency into the model building process and the model deployment process. But ultimately, when it comes to teams, I think the biggest change that I've seen is more and more analytics shops, data science shops have really realized the need that they have to collaborate extremely closely with our IT compatriots. And because at the end of the day, the days where we would build a model, have some real great insights, put it on a PowerPoint presentation, show up at a meeting and say, look at these great insights, have at it, you're welcome, and go do something. Those days are gone. They've been gone for a while, but they're really gone now. And so these models we're building, they only work if they can be operationalized, right? We're not just trying to uncover insights. That's all important. But now what we're doing is we're almost more often than not, we're using past insights around what drives certain things. And we're trying to figure out how we can then take those insights, turn it into an algorithm, and then set that algorithm loose, running on a daily or a weekly basis to look for those patterns that are based off those insights that were already known, and new ones. I don't mean to say we have to have all pre-canned insights here, and then we apply, and the whole idea of these models is to identify at scale, in real time, near real time. Here's the alerts. These are things you need to know about. It's driving actual actions. It's taking insights to actions to produce outcomes. And at that point, to make that whole process work, you've got to integrate these models into the operational systems that our company uses. And you can't do that without collaborating with IT. And so for us, we have fully 100% adopted our IT scaled agile methodology. One of the things we did 2 years ago is we actually synchronized our sprint schedules between our analytics team and our IT teams. We now do PI planning together. And so I think this whole notion of really making sure that your analytics team are really synced up and using the same type of agile methodologies that our IT teams are using is incredibly important when we start to think about how we operationalize it. Now, there's one big challenge that we're having. I don't know to the extent other companies have progressed beyond where we are, but this all leads to this new category called machine learning operations, or ML ops for short. And we today, I think we have bootstrapped a system to make that work. But it's not robust. It's as we keep on building more and more models and operation more and more models, it's not gonna last. And so we are really focused right now on how do we going to re-architect our systems to include this ML ops functionality that will really help us. And the big key thing I haven't mentioned yet that's important here is as you deploy models, you can't just deploy them where the only thing they're sharing is the result of the models. you have to provide the explainability, the traceability into why the result was what it was. And so because of that, that means we've got to, the requirements expand from a capacity standpoint, because now when you're operationalizing these models, you don't only have to just store the results and serve those results. You've also got to serve, say, the top 20 variables that were driving that result. So you go back and tell people why this result was what it was for this particular member. And so that's an area that we're very much focused on, which is to make sure we can figure out at that scale of data that how we're going to manage that. So the bottom line, the answer to your question is, it's collaboration with IT and more structured ways to collaborate and share and get the input and with all of the business stakeholders.
Krista, this has been an awesome conversation. Really appreciate you taking the time and sharing these insights. It's a great opportunity to be able to talk with a thought leader like yourself.
Well, thanks, Jake. I really enjoyed the conversation, and I definitely appreciate your time as well. So thank you.
Of course.